This podcast is part of the Frederick Podcast Network. Learn more at listenfrederick.com.
That's number one. You kind of reset your
painful, tender to the touch. May also
same shoulder length, and the other.
All right. Welcome to another. I just lost my co-host here.
Really?
Welcome to another episode of the Real Health Podcast with Brandi and Amir. I'm Dr. Amir Rashidian, a chiropractor, and Brandi Rashidian is
fast.
Not a chiropractor. What, did you go to the bathroom and what happened? You just got up, left.
I didn't have a pen.
Yeah. Well, good. Now you do. Brandi Rashidian is my other half and co-host and the face of the show, and probably the reason you all watch this because she wanted to curl up in front of the light last time. That wasn't last time. That was a couple episodes ago.
He has the light again, but he pointed it towards you today.
Oh, yeah. Well, because I'm a little more mature when it comes to these things.
Maybe you're just more gloomy. You need some light.
Listen, Sean said talk into the mic.
Maybe you're gloomy. Is that better?
Real Health Podcast is brought to you by the Frederick Podcast Network, and it can be found on listenfrederick.com along with YouTube, Spotify, and all the other outlets for your favorite podcasts. And our hope is that we bring you the information that's found in mainstream media, whatever's latest in health, illness, drugs. And our hope is we can help you feel better, get stronger, live longer, and always feel younger. And I'm feeling extra young today. Had a great workout.
Good.
Yeah.
You look younger today.
I don't
know what you did. Maybe
I'm rejuvenating.
Yeah, right now you're doing it.
It's that kind of the year. That time of the year. That kind of a year.
Boy, we're all messed up today.
Yeah, it's the drugs we take.
I have 0 drugs.
Did you work out today?
No, I did work out yesterday. I took my son. He doesn't belong to you. I took our
That
middle.
one can be yours. It's fine. I'll take the other 2.
Wow. Good thing he doesn't watch this. No. Our middle is very
He
sweet.
has a phone now.
Yep.
So technically he could watch.
But not a girl.
No. Are you going to rap again?
No. I was going to say, if you want to hear that rap, you can go back a few episodes.
That's right.
So.
2 sick chickens, back again.
That's right. Watch out. You never know what you're going to get with that group.
Anyway, so talking about exercise, we have an article, if we get to it, about how osteoporosis is actually a thing in men, not just women.
What?
And falsely, a lot of people say if you exercise, you can prevent osteoporosis. That's not necessarily exactly true. There are 2 types of exercise that can increase bone density, but doctors don't know this. You're going to know it by the end of today. So stick around to the end. Hopefully we'll get to that article. Now that I said it, we're going to have to get to it. So
that might be next week.
No, we're going to get to it.
Okay,
but why don't we start with this one? This was on KTLA News. It was sent to me by Dr. Cole Talton.
Hello, Dr. Cole.
Thank you
for your contribution.
One of our 2 favorite associate doctors. Mm-hmm. I tell you, we have a great team here at Mid-Atlantic.
We do.
But so this is interesting. So the headline says, blood pressure medication recalled over potential carcinogen, what to know. And this came out
I think you should know not to take it.
Just like 3 days ago. Nearly 590,000 bottles of blood pressure drugs have been recalled over concerns that they may contain a potentially carcinogen chemical that exceeds the acceptable intake limit.
This is what bugs me.
That's what I was going to say.
Can there be a 0 tolerance?
Well, there's acceptable limits. So,
I know.
Like this much cancer-causing agent, take all you want.
It's okay.
But don't do more.
But here's what I don't understand.
It's like a little bit of rat poison is good for you.
Correct. And then it's not like this is a one-time use. They're throwing people on these medications for a lifetime. So are you telling me, is it the safest limit per bottle, or is that over a lifetime of someone taking it?
Wait till we get to the end of the article, because the last statement will answer your question.
I'm going to be annoyed.
Just wait. So, all right. The medication affected by the recall, prazosin hydrochloride, were recalled earlier this month by Teva Pharmaceuticals USA, which initiated its recall on October 7, and Amerisource Health Services October 26. Enforcement reports published by the U.S. Food and Drug Administration, FDA, our favorite, indicate the capsules may contain nitrosamine impurities above the carcinogenic potency categorized approach limit.
How many people got cancer before they found it?
You got to watch the CPCA. This is the first time I'm hearing this. That drugs have a CPCA.
Well, so do foods.
Foods have that? Do they?
I mean, all of those chemicals, right? We've done articles about how they are deemed relatively safe, right? Like they're in the safe zone.
Like sweeteners, right?
Yeah.
All the chemicals that are in artificial sweeteners.
And what's the I was just going through, I took Ramin to the grocery store with me, and he's like, can we please get this? And I'm like, no, like, look at what's in that. It has high fructose corn syrup. We're not doing that. It has, yes, they removed the dyes, but look at all this. And then BHAT is in like everything. And that's so detrimental to our health.
The little packets used to say may cause cancer in laboratory mice.
Do not eat.
In laboratory mice.
Because they can't test it on humans, supposedly.
They're doing it.
But then we've seen
inadvertently they're doing it. So anyways, according to the FDA, N-nitrosamine impurities are a class of potentially cancer-causing chemicals that can form during the manufacture or storage of a drug. So as they store this drug, this thing forms in the drug. I mean, I would like to know a little more detail about this.
It seems suspicious.
It's either during manufacturing or as you store it, it forms this impurity. The enforcement reports show that on October 24, the FDA classified the recalls as Class 2, meaning health officials believe that the use of the affected product may cause temporary or medically reversible adverse health consequences, or where the probability of serious adverse health consequences is remote, according to the FDA. So it might give you a little cancer. Not a lot of cancer.
Don't worry, we can treat you with chemo. It'll be fine.
For $1 million, we will take you through a course of chemotherapy.
This feels so cyclic.
We may even throw in some radiation. So, all right, I'm going to skip the rest and go to the bottom here. It says doctors prescribe prazosin, which relaxes blood vessels to help lower blood pressure. Do you know prazosin, how long this drug has been on the market?
How long?
Since 1976.
Is this the first recall we've ever had?
I think so. I did not look that up. However, originally it was for high blood pressure, but then they came up with other high blood pressure medications, so they transferred this to PTSD. So it's apparently supposedly helps people with PTSD to have fewer nightmares. Oh, we got an article on melatonin coming up too. Anyways, it is also sometimes prescribed for nightmares and other sleep disturbances caused by post-traumatic stress disorder. So there you go. It says sometimes, but I think it's majority because, I mean, I would say probably a third of people I meet are on blood pressure medication. It
might even be higher than that.
I haven't met anybody who's taking prazosin. Yet 590,000 bottles were out in the market that had to be recalled.
Well, is it called something else?
No, this is it.
No, but I'm saying they do label things differently.
No, it's prazosin hydrochloride. Anyways, so this is the part that I thought you'd be upset about. It says patients with any of the recalled medications should contact their healthcare providers or pharmacies with any questions, the FDA says. The agency warns, get this, the FDA warns, however, that stopping your medicine may be more harmful to your health than continuing to take the recalled medicine.
FDA, are you flipping kidding? A little bit of cancer-causing agent is going to be way better than not taking it at all. That's your stance. Shame on you. Shame on you.
Wow.
That's shame on you. That's
Well,
ridiculous.
now I know our attorneys are flipping out because they're thinking that we're telling people to stop taking their blood pressure medication.
No, but people should contact their doctor, and if they still feel like they need something, get on something else.
Get on something else. And there's no shortage of blood pressure medication. Trust me. There are a
Not at
dime a
all.
dozen. They can be found anywhere and everywhere. They're all over the place. No pharmacy will ever run out of blood pressure medication drugs. Now, can we chat a little bit about what blood pressure is?
Yes, please.
Because blood pressure is a response, not a disease. What does that mean? It means if let's say right now I'm sitting here relaxed and chatting with you guys, and let's say I didn't just read something that bothered me, I'm reading something that actually makes me happy or joyful, should my blood pressure shoot up or go down? Technically,
Or
it goes
shift.
down.
This should change, right?
Yeah, but then you put me on a treadmill and have me run, and let's say I'm running, I'm sprinting as fast as I can, and you're checking my blood pressure, and all of a sudden it says 200 over 120. Are you going to say I have hypertension? Are you going to put me on blood pressure medication?
I like
Right, because if you lower my
'Cause
blood
that's
pressure
absurd.
at a time when I'm running full speed or lifting weights and I'm breathing heavy, I need pressure to go up. The body responds. So blood pressure is under control of your nervous system. The nervous system. So this drug, Prezicin, is supposed to relax your blood vessels. But do you know your blood vessel constriction and dilation is under the control of your nervous system? So the brain sends signals to your blood vessel saying, I want you to constrict, I want you to dilate. Why? Well, because this is going to save your life, because I need you to constrict for this reason or that reason, and now I want you to dilate to let more blood flow. It's a natural thing, and it's an ebb and flow. Go check your blood pressure like every 10 minutes for 24 hours. You'll see.
Vastly different.
It's going to go up, it's going to go down. And then watch some news or watch our podcast and check it and see what the blood pressure that it's going to go up and down. It's supposed to go up and down. So if you're stressed, if you're worried, if you're nervous, if you're angry, if you have PTSD, yeah, your blood pressure is going to be high, but lowering the blood pressure doesn't solve the problem.
Right.
It masks it.
Right.
And again, please understand, I'm not telling you to stop taking your heart medication. You keep taking it, but I want you to address the cause of that high blood pressure. Something's telling your body it needs higher pressure. By the way, this is an absolute fact which no one will tell you. You ready?
I'm born ready.
Blood pressure is supposed to increase with age.
Ooh.
So there's two different formulas. And listen, medical doctors won't tell you this. Cardiologists won't tell you this. I don't know if they even know it. But human physiologists, people with PhDs, people who understand this stuff, they'll tell you blood pressure needs to go up with age. So there are two formulas. In the old days, what they used to do was they would put a 1 in front of your age. So I'm 51 right now. So they would say my high limit of what my blood pressure should be at rest is 151. And then for the bottom number, you divide by 2 and add 10. So 150 divided by 2 is 75. Times 10 is 85. So 150 over 85 would be the top limit for me. If my blood pressure goes above at rest multiple times, let's say I take it every day for a week, multiple times a day, and it's always over 150 on top of 185, then I should look at reducing that. Otherwise, it's normal. And if I'm 80 years old, there's a chance because arteries will harden and everything else. Blood pressure is going to be higher. Another formula.
Because it takes more to get it through the arteries, right?
Another formula says you add 110 to half your age.
Okay.
And that makes it a little lower.
Harder.
So let's say I'm 51, right? Round down to 50. Half of that is 25.
Right.
110 plus 25 is 135. So 135 over 80 would be the normal blood pressure for me. Even though cardiologists say over 120 is pre-hypertension and over 130 is pre-hypertension.
Is that like pre-diabetes?
Oh,
Because
yeah.
I'm not really sold on those pre-things.
Yeah, it means you don't have the disease.
Like everyone
but
could
we're
be
gonna
pre-diabetic.
We're going to give you a drug in case you decide you want to get the disease.
Who is there's a comedian who Kevin James. I always call him Paul Blart because that's how he's known.
Mall Cop.
And he did a great stand-up on like
I think it was a Netflix
pre-diabetes.
special.
Yeah, and he went to his doctor.
Well, he said he went to his doctor, and the doctor said, "Listen, you're fine, but you do have pre-diabetes." And he said, "What? I have diabetes?" He goes, "No, you don't have diabetes.
Not yet.
You have
But
pre-diabetes."
you could get it.
He's like, "Oh, I could get it." And he goes, "Okay, well, could you ever get diabetes?" He tells the doctor. The doctor goes, "Well, I guess I could." He goes, "So you're pre-diabetic too?" He's like, "No, I'm not pre-diabetic. You're pre-diabetic."
But it's just the most absurd. I mean, yes, there is probably something too. If somebody is very overweight, right? They're not like pre-obese.
Now, listen. How they determine if someone has diabetes, and please understand, I told you at the beginning of the show, I'm a chiropractor. I'm not an endocrinologist. I am not a diabetes specialist. I am not a blood pressure specialist. I work with the spine. My job is to correct the spine, reduce pressure from the nervous system, and optimize your body. That's what I do. Okay? Having said that,
but that doesn't mean you don't have a very good understanding about how the body works.
I know how the body works, right? And I've been studying for what? How many years? 30 years?
You're old.
30 years. I've been reading from way back where I got my Bachelor of Science in Chemistry, and I got a Bachelor of Science in Human Biology, and then I got my doctorate in Chiropractic. And that's when my education started, was when I was out of school, because then I started seeing patients and then looking up issues and going, what the heck is going on with this one or that one?
Go a little deeper, because before that, you also worked at NIH. And you were involved in studies and stuff.
We did some studies on cholesterol and so on. Now, here's the thing. When it comes to blood sugar, blood glucose levels, they take your fasting blood glucose, and if it's high, they tell you have diabetes. And if it's not too high, they say you have pre-diabetes, right? And they have different drugs for each one of those things. But here's the fact. Blood sugar should go up and down. Blood sugar will go up even if you're fasting and you're angry or upset. So it should not be based on one blood test. It should be based on multiple blood tests over a period of time. Also, let's have you eat a big breakfast. So let's check your blood sugar before you eat, first thing in the morning, fasting. And let's say it's 85, which is normal. 80 to 90 is good. Below 80 is okay. Below 70 is too low. And then above 90 is a little high. Over 100, they say you're diabetes. So now then eat a big breakfast and check your blood sugar right after you eat. Check it again every 20 minutes afterwards for about 4 hours, and write it down. And let's see if your blood sugar will spike and crash, or does it go up slow and come down slow before your next meal. If it goes up slow and comes down slow, great. If it spikes and crashes, you're not handling your blood sugar properly. You're not metabolizing correctly. Your insulin levels may be, off, or you might have insulin resistance or something like that. So, no one does that. No one checks blood sugar that way, but that's how it should be. Guess what? It's inconvenient, and it would cost too much money for doctors to order tests like that.
Right. Well, and people, as humans, we can do this stuff on our own. We don't need a doctor's order to check our blood sugar. You can literally jump on Amazon. You can get yourself a glucose meter, and you can do your little pinprick at home, and you can test it, and you can do it regularly. And then you have the data. You know what your body is doing. You know why you feel a certain way before you eat, after you eat. See how your blood sugar is regulating. And then talk to someone. If it's not doing well, then there are things that you can do. There are certain ways that you can eat. There are certain supplements you can take to help process better. There's a whole number of reasons why that might be happening too. So talk to somebody who's skilled in that and who's willing to discuss supplementation, not just pharmaceuticals. Because if we think that the only way to solve any issue in the body is to jump to pharmaceuticals and surgery, then you've just shot yourself in the foot, because there are so many ways to skin a cat. There were ways that people dealt with this kind of stuff before pharmaceuticals were even invented. Your pharmaceuticals are often created based on natural plants and herbs that do the same thing. And now all of a sudden, those plants and herbs are no longer safe when they were used for hundreds and thousands of years. And now that we have a pharmaceutical that is synthetically made and has all of these side effects, that's what we're told is safe.
So my father...
Do your own research.
My father went to medical school in the 1940s. He was born in 1923. And back then, you didn't have to go to undergrad and then medical school. You go straight to medical school after high school. So he was in medical school, and his professor played a joke on the whole class. And he said, here's how you diagnose someone with diabetes. You need to taste their urine. If it's sweet, they have diabetes, which is true. It's actually true, but I don't think they do it. They'll put a dipstick in there and test to see if there's...
If not, you are the dipstick, for the record. Sorry.
So he said he had a cup of urine. He said, stick your finger in it and taste it. And the students almost did it, and he stopped them. He said, don't do it. I'm kidding.
That's funny.
Anyways, that's medical school in the 1940s. This was in Iran, not in the United States. So anyways, want to talk about getting up to urinate in the middle of the night?
I mean, we did just talk about urine.
That's right.
It's a good segue.
It's a very good segue. I didn't even plan that one.
I know.
So New York Times says experts weigh in on what the urge means and what you can do to curb it. By urge, they're talking about urinating at night. So nightly trips to the bathroom are normal. About a third of adults over 30 and half over 65 do it or do so. Only a medical issue. It's only a medical issue if you have to do it more than twice a night, or if you have trouble going back to sleep afterward. While urinary issues like an infection or overactive bladder may be to blame, conditions like diabetes, heart disease, and sleep apnea can also cause nocturia. Nocturia is nighttime urination.
Yes, as can a vast number of pharmaceuticals.
Yes.
It's a side effect for so many.
At the most basic level, nocturia happens for two reasons. Your body is producing too much urine at night, or your bladder can't hold as much as it used to. About a third of people deal with both. When you're young, your body produces most of its urine during the day. This is something I had no idea about. Did you know when you're young, and I guess as you get older, urine production shifts toward the night because of hormonal changes and declines in kidney function. Aging is also linked to less elastic bladders, weaker pelvic floor muscles, and enlarged prostates.
That's for sure.
So what should they do about a weak pelvic floor, Brandi?
Well, there's many options, actually. There's some that are more invasive than others. There's a lot of pelvic floor therapists that specialize.
The non-rubber glove technique is what I would be interested in.
Well, I'm going to get to that. So there are some more, I hate to call it invasive because it's not, I mean, they just have to get in there, ladies. So if you're working with a pelvic floor specialist, they're getting in there. It's going to be like being pregnant again. So you're going to have somebody up there nonstop. And for some, that's very helpful.
Now, keep in mind, men have it too.
Correct. The challenge is that for some individuals, especially women, birth is traumatic for our bodies, as it can be for babies as well. And sometimes there can be damage to the motor nerve that could be from the birthing process, that could be from other trauma. If you've ever landed on a bicycle, little pole, things like that. There are all sorts of things that can cause that. But if your motor nerve is damaged, then some of the exercises you're going to be expected to do, you may not be able to do anyway. So that's where some of the pelvic floor therapy can fail or not work as well for individuals. And it can be quite a long process, 12 plus months to see some kind of remedy. BTL is a PT device company, and they created a device called the IMSALA. And the IMSALA is a non-invasive pathway to a device to be able to have a very rigorous workout done on your pelvic floor without you really feeling it. And 2 treatments a week for 3 weeks can really, really help mild to moderate stress incontinence for both men and women. And so that is something that we have in our clinic. I think there's a few others around the Maryland, Virginia area that have them, but those can be very, very helpful. So there are alternatives to mesh and, to surgical. So if you want to try something non-surgical, non-invasive first, this is one option. The one thing I do like about the EMSALA is that because it works on a neuron level, it does bypass the motor nerve. So if there is damage to the motor nerve, it bypasses that altogether, which is great. But
yeah, it artificially contracts,
Yes.
causes maximal contraction. Diabetes and high blood pressure can cause nighttime urination as well. And obviously during pregnancy, your uterus might press on the bladder, causing frequent urination. Sometimes this the funny thing is they say high blood pressure can cause it, but actually some of the medication you take for high blood pressure will cause more nighttime urination. Like if you're on a diuretic like hydrochlorothiazide, you're gonna urinate more because it's a water pill.
Yep.
So during pregnancy, your uterus might press on the bladder, causing frequent urination. Additionally, your legs and ankles can swell, which most ladies who have expected know. And then when you lie down, the fluid moves into your bloodstream and eventually your bladder. So when you lie down to sleep at night, that's why I say put your feet up during the day. This can also happen with heart failure and vein issues. Sleep apnea can also play a role since disrupted breathing also causes your body to produce more urine at night, which when your carbon dioxide levels go up, I think, and makes your blood more acidic. This is why a continuous positive airway pressure or a CPAP machine can actually reduce nocturia. So if you do have sleep apnea, use your CPAP. According to a 2019 analysis, nocturia was tied to a 20% increased risk of falls and 32% increased risk of fractures. So these are people who get up in the middle of the night to go to the bathroom, they fall, they break something.
Yeah. Now, I will say with the EMSALA, urge incontinence overall is a little bit harder to remedy. We can get it better often, but we can't always resolve at 100%.
Yeah, because there's kidney involved and other things. It's not just a pelvic floor issue.
Correct. And sometimes we're working against a medication that is actually continuing to weaken the pelvic floor.
Yeah.
Remember, it's a muscle. So if we're fighting against something that continues to weaken the pelvic floor, we can keep building it up, but if we're constantly fighting with it too. Right. So, there are...
And just also remember, insulin fluctuations, blood sugar fluctuations will cause your kidneys to wear out, and they end up producing more urine and allowing more water into your bladder. And so improving your sleep hygiene can help limit the number of times you wake up at night. One key step is staying clear of tea, coffee, and alcohol in the evenings, since they not only disrupt sleep, but also cause your body to produce more urine. Now, which do you think produces more urine, tea or coffee?
Ooh, that's a great question.
Now, there's a drug called hydrochlorothiazide, which is a diuretic for blood pressure.
I'm going to say tea.
And tea has thiazide in it.
See,
which increases urine. It's a stronger diuretic than the caffeine and coffee. So
a lot of people, is that also what makes people susceptible to like
kidney stones?
Kidney stones?
Yeah.
Okay, so if you're a tea drinker, be cautious. You want to reduce that because that high consumption.
Yeah, if you drink a lot of tea during the day, you need to drink that much more water.
There you have it.
Otherwise, you get a kidney stone. A good rule of thumb is to avoid water and other fluids 2 to 4 hours before bed. That includes coffee and tea, not just water. Alcohol.
Probably any fluid.
I don't think they mentioned alcohol in this article, but I think people who drink right before they go to bed, I think, have to get up a lot.
Live radio, local podcasts, the Frederick Podcast Network at listenfrederick.com.